Welcome to Shaping Healthcare, a podcast by Citius Tech. I'm your host, Laurel Rockel. Across the healthcare industry, organizations are facing growing pressure to evolve, whether it is responding to new care models, integrating emerging technologies like AI, or navigating shifting regulatory landscapes. These changes are complex, and while strategy and systems play a role, the real challenge often lies in how people within the organization adapt. That brings us to today's episode, where we will explore the role of organizational change management in enabling successful transformation in healthcare. Joining me today is Dann, Vice President at Citius Healthcare Consulting. Tom, welcome to the podcast.
Thank you. Thank you so much for having me. Really excited to be here.
I'm very excited to have you. I'm looking forward to our conversation today. And I think a good place to open it up would be sharing about your position and some of your background before we get into the rest of the conversation.
Yeah, for sure. So I'm the Vice President for the Change Management Practice. So I lead the Change Management Practice here at CHC. And I spent my career in healthcare organizations helping them navigate transformation. So that's everything from digital transformation, digital modernization, AI integrations, to operating model redesigns and workforce enablement. At its core, my work is really about people and helping organizations not just implement change, but actually able to adopt it and live it and sustain it. I lead a practice of what I call change strategists or behavioral scientists and transformational coaches who are passionate about one thing, and that's translating technology investments into human impact. So, healthcare is deeply, deeply personal. Every change we drive, whether it's AI changes, new workflows, clinical systems, implementing new technologies, just to name a few, it touches real people. And that's what makes my work so meaningful to me. It's not just about business transformation. It's about trust. It's about compassion. It's about creating systems that empower our clients to improve the lives that they touch. So I am thrilled to be here, Laurel, today to talk about what is changing in healthcare, why organizational change management, or OCM, matters now more than ever, and how AI is rewriting the playbook for transformation.
Yeah, that's excellent. And certainly with change management being people-centric and client-centric is of course very important as people are changing. But can you elaborate on what exactly organizational change management means in the context of healthcare and why that is so critical today?
Yeah. Well, first, that's a really good question to start with, because the truth is, healthcare change management is unlike any other industry. When we talk about change in healthcare, we're not just talking about systems or process. We're talking about people who impact the lives and well-beings of their members or patients. Clinicians, care teams, administrators, all of whom are under incredible pressure to deliver care. So organizational change management, or OCM, is really about helping those people adapt, align, and ultimately thrive through transformation. It's about connecting the dots between technology, operations, culture, so that transformation isn't just a rollout, it's a behavioral and mindset shift that we can measure and attach some kind of a business value to. So what makes it so critical now is the velocity of change. And what I mean by velocity of change is that technological breakthroughs, the speed of and impact of change are becoming much greater in the work that we do. So we're seeing AI come into play now. We're seeing interoperability, regulatory reform, digital front doors, all converging at once. And the risk isn't that these technologies won't work. It's the risk really falls on the people who may not adopt them. So that's where change management steps in, and it bridges the gap between project success and human adoption. So I often say that technology doesn't fail, it's adoption that fails. And in healthcare, the adoption directly impacts patient outcomes and the client's ability to provide excellence in the people that they serve.
And certainly with all these changes and having to adapt and change and roll with the punches and all these things that are happening within our healthcare organizations, From your experience, what are some of the biggest challenges healthcare organizations are facing when they're trying to implement change? And how does change management help to actually address these challenges?
Yeah, I think that's a really good question because there's a lot of challenges that I could speak to from a health organization perspective and what OCM does for them. But I'll start by just picking three or four big ones that I continually see, no matter the size or the type of the organization. I would say the first one would be competing priorities. So whether that's clinical operations, staffing shortages, compliance, they all make it hard to focus on change. And organizational change management, or OCM, it helps to integrate change into daily routines. So it's not just extra work, but it's part of how we get the work done and really connecting that piece of it. The second part, I would say, is going to be leadership alignment. And many transformations stall because sponsorship just isn't consistent, isn't around, isn't visible. And change management gives leaders a roadmap. It explains how to communicate, to connect the why to the change, how to model behaviors, and how to sustain momentum. The third, I would say, is change fatigue. So when healthcare workers have lived through constant transformation cycles, whether it be electronic medical rollouts, EHR rollouts, mergers, cost initiatives, the fatigue portion of change is very real. And the OCM part of it approaches that part of the human element with empathy, transparency, and recognition to rebuild trust. The fourth, I would say, that I would bring to the front of the room would be data literacy and technology trust. And relating that back to AI and analytics only add value if people trust them. So if we don't trust the technology that we're implementing, that we're not going to adopt it. And through storytelling and peer champions, we humanize the data so people see AI not just as a threat, but it's an ally. And there's an emotional component that needs to be addressed in adopting some of these technologies. So I would say, in short, OCM translates strategy into human behavior, and it's the difference between executives approving a roadmap and our clients actually living out the changes to impact how they serve.
Can you share a specific example where change management made a measurable difference in this transformation?
Yes, yeah, for sure. I'll share two quick ones on that one. So I have worked with large provider networks implementing new care coordination platforms, and the rollout was technically flawless, but the adoption was lagging. And adoption lagging in areas of role clarity, training gaps, absence of real time feedback, emotional restraints, emotional resistance, and over focus on the go live milestones and technical delivery aspects. The organization celebrated the rollout, but not the sustainment phase. And the sustainment phase is really where the change management parts come to life. And so the result was adoption at around 50%. What did we do? We introduced a structured change management plan for leadership, coaching, role-based training, and real-time adoption dashboards. That enabled us to, within 6 months, adoption rose to nearly 90%, so a huge jump there. But the bigger story was qualitative. The clinicians reporting saving time and feeling more confident in their workflows. So with those results, I can draw a clear line from business outcomes and supporting a client. One other case that I would mention is with a national payer, and I helped them modernize their claim operations. There was inconsistent leadership reinforcement, limited visibility into adoption metrics, training that was focused on the how or technical aspects of the work and not the why. So we weren't able to connect the why, which resulted in users learned where to click, but not how it made their day-to-day lives easier. We built a change management champion network of over 200 employees across several departments and business units, and that network became the voice of adoption. So they gathered feedback, they shared wins, they surfaced resistance early, and what was the result? Post-go-live disruptions dropped by more than half. So more than 50% reduction in disruptions, and employee engagement actually went up during the change by using some of those tactics. I would sum that up as some of the power around change management when you design it right and people start feeling like the change is happening to them and start feeling like the change is that they are a part of the change. And when you say it like that, there's a big difference between those two approaches.
Those are excellent examples and great numbers and changes in those numbers of the adoption, as well as, like, as you mentioned, that people didn't feel like this change was happening to them. They felt a part of it, and therefore we're seeing the benefits, the positive, all those positive benefits of said change. I'd like to pivot a little bit. You mentioned AI earlier and trust around digital tools and being able to adopt them, trust them, moving forward with them. Healthcare is increasingly adopting AI. All fields are adopting AI, really. And how is it influencing the way organizations are approaching their change management? And are you seeing any new opportunities or challenges along with this?
Oh yes, Laurel. That is a lot of changes as it relates to AI. AI is I would say a complete game changer for change management because it's reshaping how we sense, measure, and drive adoption, proficiency, and utilization around the initiatives that we're changing. So traditionally, we've relied on surveys and interviews, anecdotal feedback to gauge the readiness and resistance portions. Now, AI allows us to analyze real-time behavioral data. So communication patterns, sentiment analysis, even workflow analytics, that enables us to identify friction points far earlier than we have been able to identify, which means we can move forward being reactive rather than predictive. And that really changes the game. So it also allows us to personalize the change experience. Instead of a one-size-fits-all communications, we can tailor our messages, our training, our reinforcement based on role and engagement level, and even learning style. There's a huge level of customizations that AI enables us to do that we weren't really able to do with the manpower that we've had. We're able to multiply our forces within change management using AI, and that minimizes the workflow and the work needed to our end client in order to execute personalized change experience that drives real results. So this is important. And AI introduces new challenges as well. So it's not all it's not all roses. There's new challenges that end up happening with AI, and a big part of that is fear around AI because it's so new and we don't know its capability and how it ties into organizations. There's ethical tensions that end up happening and questions about trust. So change management's job now includes building digital trust and helping teams understand what the AI is doing, why it's making certain recommendations, and how in many cases it's supporting human judgment rather than replacing it. I think that if I were to something that I like to say is AI won't replace change managers, but change managers who use AI will replace those who don't.
Mm-hmm. Excellent points. Yeah, and I would like to dig in actually a little bit deeper with what you're saying here, and actually, and looking ahead too, as that AI becomes more embedded. How do you see the future of change management, and also Citius Tech's role in shaping that?
For sure. Yeah, I think that the future of change management is in healthcare is going to be data driven, continuous, and deeply human. We're moving from managing one-off projects to building adaptive capacity, helping organizations become fluent in change. That means AI is not just for analytics, but it's for foresight, predicting adoption gaps, recommending interventions, and continuously learning from the data. So here at CHC, we're uniquely positioned because we have lived the intersection of technology, data, and people, which gives us a really competitive edge in the marketplace because of how well we know our tech side and how we use our data. And when we add the human element to it, We have that technical backbone and deep AI and data capabilities, and we pair that with the human understanding of transformation. That's powerful. Our role to help health organizations move beyond change management as a phase to change enablement as a culture is really important. You can imagine a world where data dashboards show not just the system uptime, but also adoption health, where leaders can see in real time how change is landing with their teams. And that's where we're headed. We're a world where adaptability is new, competitive advantage. Um, that and the change management isn't just a function; it's part of an organization's DNA. So we're also preparing organization organizations for changes that we don't even know exist. And that's part of the AI. I mean, change management sets up an organization to become more agile and adaptive, not just technological advances, but also compliance changes, security changes, internal organizational disruptions, yeah, mergers and acquisitions, just to name a few.
Being that you have that really prime spot and the experience within that prime position of the intersection of all those things working together, and from that vantage point, I guess I should say, what have you noticed as the biggest gaps between how leaders think change happens versus how it actually happens?
Yeah, no, nice. I think the change from, especially from a leader perspective, I think leaders often think that change happens through communication or just training, when in reality it happens through consistency and post live, the sustainment phase of the go live. You can't just announce that. You can't just announce the what in the changes. You have to live that why piece of it. And teams watch leaders do far more than what they say. So the best sponsors I've seen are visible, they're empathetic, they're patient, they model adaptability instead of demanding it. And when I'm coaching leaders on success and change, I will often tell them that the success that brought you to this level doesn't necessarily bring you to that next level of success, and that you will get to the next level of transformative leadership is going to be a different approach. And that's part of the change management process, and is in coaching those leaders to be transformative leaders in that environment.
So, Tom, what about the executives who want the change quick? We want quick change, quick results, but might underestimate the human curve of adoption. How do you coach executives through that?
Yeah, good one. I think that's a good follow up there. I will tell them that people adopt change at the speed of trust. So you can accelerate your timelines, but you can't necessarily accelerate the emotional aspect of the human experience that goes along with that. And when leaders invest early in communication, in training, and role modeling, they actually shorten the adoption curve, because people feel safe to change is really what we're chasing. And it's not just about slowing the project down, it's about building confidence to go faster. And that's where the change management piece really ties in nicely in what the work that I and my team does. So that requires significant investment in people. And that is where the change management process lives.
And for the leaders who, when we talk about something that you mentioned earlier, was change fatigue, and and going through that process, and coaching people through that process. What is a misconception that leaders might have regarding change fatigue in this process?
Yeah, yeah. I think that most leaders assume that fatigue means that people are resistant, but it usually means that people are just tired of change that isn't well managed, is usually what that means. And fatigue isn't from too much change; it's from change that is has too much uncertainty and too many competing constraints. When communication is fragmented and priorities are shifting, even the most resilient teams end up burning out. The antidote isn't less change, it's more clarity. And it's building trust and creating a North Star in the vision of what tomorrow looks like, while connecting the why behind the change and how it impacts the people and the clients that we serve.
All right, Tom, as we begin to wrap things up here, if you had to sum up OCM in one sentence for a client CEO, what would that be?
Oh, good one, man. That's a tough one, isn't it? Just to get it all in one sentence. I think that change management turns transformation from a technical go live into a human success story. And it's the difference between project completion and true adoption. So as long as we rely on people for success in the work that we do, we will need change management to support them.
You've brought some really excellent examples and some really, just some really wonderful gems around change management and looking forward into that future as everything is rapidly changing and how we coach people through that first and foremost. So I would love to hear just maybe some closing thoughts for today's intro podcast to our change management series.
Yeah, no, thank you for that. I think so. In many ways, the story of change management healthcare is the story of humanity meeting innovation and the clients that we serve. It's about using technology to enable people, not the other way around. And especially as AI evolves, our job as change leaders is to make empathy, transparency, and trust evolve right alongside it. So, we look, as we look at the future of healthcare, I think that one thing is very clear, that change is not going to be slowing down. If anything, it's becoming faster and more complex and has a greater impact to how we work. And whether it's AI, interoperability, new care models, transformation is constant. I think the question isn't how do we manage change, it's how do we make change a core capability of who we are. I think the future of change management is continuous learning. It's data-driven insights. It's the human-centered design working together. And it's about building organizations that are resilient, adaptable, and confident in the face of transformation. I know that here at CHC, we're deeply committed to shaping that future and combining healthcare expertise, digital innovation, and change leadership to help the clients that we serve not just survive any disruptions, but thrive in uncertainty and be able to lead through it. So if I could leave listeners with one thought, I think it would be that technology may enable transformation, but people sustain it. And when people are at the center of the clients that we serve and the people within the organizations that we support, that's when innovation really delivers its promise.
Yeah, that's an excellent closing thought. Thank you so much. And thank you for sitting down with me today. Thank you for your time and your expertise and your passion for people and coaching people through change. And folks, for our listeners, please stay tuned for some more episodes in our change management series. Thanks again. The Shaping Healthcare podcast is brought to you by Citius Tech, a leader in healthcare consulting and IT services. To find out more about Citius Tech, visit citiustech.com. To listen to more interesting insights on healthcare technology and innovations, search and subscribe to the Shaping Healthcare podcast. Thank you for listening. If you want to share any feedback or would like to be featured in our podcast, do write to us at citiusvision@citiustech.com.